Hello everyone, I hope all of you are doing fine. So, I'm Shabana this side, your friend and colleague, and today I am here to discuss about the domain of patient safety, a very important domain which is tested in the Part 3 MRCOG exam, and Royal College emphasizes too much on this domain. Why? That is because if you pass MRCOG exam, it means that you are a safe doctor, you are a safe ST5. So, I've tried to keep it as simple as possible, and I'll be discussing about this domain with some examples. The simplest example is when we will be prescribing the high dose of folic acid, 5 milligram dose. So, for example, in obese patients where the BMI is 30 or more, in certain medical conditions like type 1, type 2 DM, sickle cell disease, thalassemia, previous baby with neural tube defects. Yeah. Then, second patient safety point is where the patient is taking alcohol and you have to prescribe a certain drugs. Like in stations of bacterial vaginosis, you will be prescribing the patient metronidazole. So we need to stop the alcohol because we know with alcohol, metronidazole can cause disulfiram reaction. Likewise, when we are prescribing methotrexate in cases of ectopic, stop alcohol. When we are prescribing methotrexate, then also we have to tell the patient to use effective contraception for at least 3 months. Why? Because it is a teratogenic medication. So similarly, when we have to offer the patient the rubella vaccine, she has to avoid pregnancy for at least 1 month. Then we need to know about the rhesus status of the patient, because if she is rhesus negative, then we have to offer her anti-D. In early pregnancy complications, like if she has severe bleeding and there is threatened miscarriage in cases of ectopic, if she is going for prenatal diagnostic tests like CVS amniocentesis, in cases of IUFT or external cephalic version. Then coming to the allergies, that's something very important. Always in the history, before prescribing any medication, we always ask the patient whether you have allergy to any food, drug, or metal. And very important is the latex allergy. So in that situation, we have to document if patient has any sort of allergy. If she has latex allergy, we will be using the latex-free gloves, latex-free equipments. If she has allergy to any antibiotic, for example, to penicillin, and if we have to offer her the intrapartum antibiotic prophylaxis, that is the GBS prophylaxis, then we have to be very careful. If she has mild allergy to penicillin, then we can offer her the cephalosporin. Okay, but if she has severe allergy to penicillin, we are going to offer her vancomycin. Then another important point is about the induction of labor. Because in certain situation and in certain medical condition, we need to deliver patient at a certain gestation age, and we just can't allow her pregnancy to go beyond that gestation age. For example, in patients with sickle cell disease, offer her induction of labor after 38 completed weeks. Those with type 1 and type 2 diabetes and where it is well controlled, then we will be offering induction of labor between 37 to 38 plus 6 weeks. If she's a case of GDM, then offer induction of labor it is at 40 plus 6 weeks. Yeah, that is before 41 weeks. Likewise, if her age is 40, she needs to deliver by 40 weeks. Okay, that is patient safety, because if her pregnancy goes beyond that particular gestation age, then there is risk to her and her baby as well. Okay, and yes, twins also, we know that if this is the dichorionic diamniotic, we will be delivering her between 37 to 38 weeks. If it is monochorionic diamniotic, deliver between 36 to 37 weeks. There are many examples like that. Coming to contraception, that is also another important point. And like, for example, if the patient has come for emergency contraception, Like we know the tablets, levonorgestrel and Elovan, that is ulipristal acetate. So if the patient is taking enzyme-inducing medication, then we will be offering the double dose of levonorgestrel, that is 3 milligram instead of 1.5 milligram. When we are prescribing Elovan, we have to take into consideration that if patient is severely asthmatic on corticosteroid, we're not going to prescribe Elovan. And also if she is on proton pump inhibitor, she is breastfeeding, Elovan is contraindicated. And another emergency contraception is the copper T, the copper coil. So we have to rule out any copper allergy and any active vaginal infection. Then the medication, enzyme-inducing medications, particularly in patients who are epileptic. So in these patients, we know that we can only prescribe them 3 types of contraception. That is the copper IUCD, Mirena coil, and injection DIMPA, that is depot medroxyprogesterone acetate, because these are not affected by the enzyme-inducing medications. Okay. Then low molecular weight heparin, yes, we are prescribing it antenatally, postnatally, and we will be, that is according to the VTE risk score. So we know that if the risk is 3 or more and there is no previous history of VTE, then we will be prescribing low molecular weight heparin thromboprophylaxis from 28 weeks of gestation. If there are 2 risk factors, then that has to be postnatally, at least for 10 days. In some cases like hyperemesis gravidarum and patient is hospitalized, we have to offer her thromboprophylaxis. In OHSs, thromboprophylaxis is important up to at least 12 weeks. Yes. And then we will continue it further, which will depend upon the risk score. Yeah. Also, while discharging the patient or allowing her to go home, there are certain conditions, like if, for example, it is OHSS, and if it is moderate OHSS and the patient is having severe vomiting, she's not able to keep the fluid down, admit her. Ectopic, fetal heart activity is present, patient is symptomatic, offer admission. Patient is refusing admission, involve your consultant. Why? Because you are working at the level of the ST5. I know in your setup, like many of us are working as consultant, but for the sake of this exam, we have to behave as an ST5. So we have to know our limits, particularly our clinical limits. So we will be involving the consultant where required. We will be involving the MDT where needed. Okay, so that is all about the patient's safety in these cases. Then coming to the confidentiality, a very, very important point. For example, if there is a teenager who has come for consultation, she wants termination of pregnancy or she wants contraception, then you have to assess her mental capacity. And if she is mentally competent, then yes, you will be offering her termination of pregnancy or contraception. Maintain her confidentiality, but at the same time encourage her to inform her parents. But you just can't coerce and force her to inform her parents if she doesn't want to do so. If you think and if you find that she's not mentally competent, then you have to involve the persons with parental responsibility. And issue of confidentiality is there in subfertility module. You're not going to disclose the results of either of the partners to either of them without their consent. Okay, then coming to domestic violence and sexual assault. Again, if the patient does not want you to inform the police, you're not going to inform police. But if you see that other person's safety is at stake, there are children whose safety is at stake, then you have to breach the confidentiality. You will be informing your consultant and the police and safeguarding team. Okay, then coming to the clinical governance, there are very important points here. That is the incident reporting. And there are some indications, like few examples, particularly in cases of complications in obstetric cases, like if there is 3rd or 4th degree perineal tear, shoulder dystocia is there. There's undiagnosed breach in labor. In intraoperative complications, like there was bladder or ureteric injury, bowel injury, medication error. So these are few examples, okay, of incident reporting. Then in clinical governance part, in cases of complications, you have to remember the 5 Ds. That is documentation, DATEX, that is incident reporting, debriefing the patient, debriefing relatives, debriefing team, performing the duty of candor, and departmental meeting. Now these Ds, these 5 Ds, these are the buzzwords. Okay, so whenever you get any station where there is post-operative complications, you have to speak out these 5 Ds, okay? Regarding the examination, very simple point. Always tell the patient that I would like to examine you with your permission and the presence of chaperone. Then disclosing the results, again, tell the patient I have your result right in front of me and I have confirmed your name, date of birth, and NHS number. I have confirmed that the result belongs to you. And this is the result, okay? Coming to Jehovah's Witness and the patient's religious belief, yes, we need to respect her religious beliefs. And we know if the patient is Jehovah's Witness, she is refusing blood transfusion, even in life-threatening condition, then we have to respect her wishes. Our job is to tell them that blood transfusion is life-saving. If she is still refusing that, then yes, respect her wishes, respect her religious beliefs, because she has the autonomy. Make sure that she has also signed the advance directive form and need to inform the other staffs and healthcare professionals involved in her care. Again, Jehovah's Witness is a very important point in cases of labor ward prioritization. And labor ward prioritization, yes, the triage is important because here we will be triaging and managing the patients as urgent, semi-urgent, and non-urgent case as per the urgency of the situation. Then patient safety points in the procedures, the surgical procedures. That is, we have to follow the WHO surgical safety checklist. There has to be informed written consent. Need to confirm the patient's LMP, rule out pregnancy in females of reproductive age group. Okay, so like this is about the patient safety points in general, and I'll try to cover patient safety points module wise in my next audio. So that's all for now. Thanks for listening, and I hope this is helpful. Bye bye and take care.